Good afternoon, everyone. Welcome to our presentation today. We're going to get started in a couple minutes. I just want to give everyone time to join. Okay, thank you for joining us this afternoon for our accreditation presentation. Welcome. You may see the message in the chat box as we get started, and if you want to enter your name, travel affiliation, and organization in the chat box as you enter, please feel free to join that conversation. Thank you. Welcome to Accreditation at a Glance, an overview of the AAAHC Joint Commission, CARF and NCQA standards virtual learning session. My name is Emily Baer. I will be your host and facilitator today. I'm a public health associate within the Technical Assistance Division at PARC. And this is a 1-hour session for this afternoon. Could we go to the next slide? As we get started today with our agenda, I just want to mention that this is our first and kickoff session in our new Spring 2021 accreditation series. So this is the first of 4 sessions and will be a brief overview. This series is focused on providing ways to support UIOs to learn more about different accrediting bodies and their processes, standards, and best practices for undertaking their accreditation processes. The agenda today, as you've seen, we wanted to welcome you all, and I appreciate everybody who's been able to put their name and everything into the chat box. Thank you very much. Today, we're just going to go over some housekeeping, brief Zoom etiquette, etc. And then we'll go into the introduction of our presenters today. We do have 4 different presentations today. We will be hearing from Zepporah Fuller about the AAAHC, and she will also be leading our NCQA section. Tiffani Stark will be briefing us on the Joint Commission, and Dr. Marc will be leading us on the CARF section. Following all of these presentations, we will have time for a brief Q&A. I did want to mention that we do have a survey and evaluation for this event. So if you want to kind of give us your feedback and your feelings about how you feel the event went and any topics that you'd like to see in the future, any future suggestions, that survey will be available after this session, and it is also in the chat box. So if you want to just open that up and feel free to take it after the session, that would be awesome. Thank you very much. Next slide. So a little bit about NCUIH. Some of you may be familiar with NCUIH already. We are the National Council of Urban Indian Health, and as you heard, we do have our acronym, so NCUIH. And we are the national nonprofit organization devoted to the support and development of quality, accessible, and culturally competent health and public health services for American Indians and Alaska Natives, or you may see AI/ANs, living in urban areas specifically. So we're actually the only national representative of the 41 Title V urban Indian organizations, or UIOs, under the Indian Health Service, IHS, in the Indian Healthcare Improvement Act, ICWA. So our goal is to improve the health of over 75% of the AI/AN population that lives in urban areas, supported by quality, accessible healthcare centers. So we're here to support you. Next slide, please. So just a brief reminder for those of you who may be less familiar with the Zoom platform. This is a slide on how to ask a question or comment in Zoom. It looks like most of you are pretty familiar with the process so far, but as a reminder, you can select chat at the bottom of your Zoom screen. It would be in the center toolbar at the bottom, and then type your question or comment into the chat box that will appear on the right. If you just press enter, then it will appear here. If you have questions as you go along, feel free to enter them. We will be monitoring the chat box, and we'll make sure they are included and addressed in our Q&A. Today, we wanted to thank our wonderful internal NCUI talent. We are so grateful for them being able to give us this overview today and lead us in this important session. We have Zepporah Fuller, who is the Director of our Technical Assistance Division, Dr. Marc, who is our Senior Program Manager, and Tiffani Stark, who is the Public Health Program Assistant. We all work within the TA division here, and they may give a little bit more of an brief overview of themselves as they begin their presentation. As a note, we will be offering polling questions as we go throughout the presentation, so do please be aware that those may be popping up on your screen, and we'll give further instructions as you see them. But with that, I just wanted to say thank you to our wonderful presenters for being able to join us today. Thank you all for your time for the session, and I will hand it over to Zep.
Thank you so much, Emily, for that introduction. Yad to everybody out there. My name is Zepporah Fuller. I am the Director of Technical Assistance. I also go by Zep. Thank you all so much for being here today. We definitely are appreciative and definitely are looking forward to the future partnerships that may stem from these presentations. So just a quick, overview of all 4 sessions that are occurring today. We will have some deeper dives later on this coming month. Our team has been very hard at work trying to create communities of learning so that your organizations are able to walk away with tangible materials. So we are really excited for this accreditation session. So I'm going to go ahead and focus on the AAAHC today, and we're going to hope to give you guys some robust information, just some foundational knowledge to prepare you for the deeper dive session. Next slide, please. So a couple of things about the AAAHC. Their mission is to improve healthcare quality through accreditation. They were founded in 1979 and currently have over 6,100 organizations accredited. They are the leader in ambulatory healthcare accreditation. Their mantra is that they promote high quality healthcare through development and adoption of nationally recognized standards. They also provide a valuable survey experience founded on a peer-based educational approach to on-site reviews. The good thing about the AAAHC is that they are very much a learning environment. They like to foster a bi-directional learning environment where it's teaching any additional strategies that are effective to be implemented within your organization. They have a really great quality framework as well. So they could be recognized as one of the more educational accreditory bodies. Next slide, please. So what does the AAAHC do? They accredit a wide range of outpatient settings. So there's a list here, more specifically for the ambulatory centers. There's the ambulatory surgery centers, but there's also ambulatory centers as well. They accredit ambulatory healthcare organizations for a 3-year term. Some additional settings that they do accredit are office-based surgeries, endoscopy centers, student health centers, medical and dental group practices, community health centers, employer-based health clinics as well, and also Indian and tribal health centers, just to name a few. In addition to the accreditation preparation, they offer a consultative and educational survey process. As mentioned, they do offer some toolkits and some resources as well, which we'll briefly delve into. Their manual of standards is inclusive of all satellite clinics that you might have. They have a great checklist and spreadsheets that you guys can work through as you guys prepare an on-site survey readiness assessment of your organizations. So they are very flexible and adaptable to the needs of various ambulatory settings. And they also have a great relationship with the Indian Health Service, which I'll also touch on in just a moment. Next slide, please. So AAAHC has a host of programs under their umbrella. They offer a certification, which is a 3-year specialty program that focuses on patient outcomes and is built on accreditation requirements. And that's more specifically for advanced orthopedic facilities. They also offer education. They have rolled out a 1095 Learn platform, which provides resources to customize quality practices and ongoing engagement throughout all 1,095 days of the accreditation certification cycle. They also have a full listing of all AAAHC products for sale. They have some white paper publications as well as patient safety toolkits also incorporated into this section as well. They also have an international accreditation program, Accreditas Global, which helps to accredit overseas agencies. They also have a quality component, quality arm, if you will, the AAAHC Institute for Quality Improvement, and they conduct research and they design tools to help improve the quality of healthcare. Next slide, please. So why the AAAHC? I know that a lot of our UIOs have started to do readiness assessments to determine if their organization is ready for accreditation. And so they have a contract, if you will, of services or benefits of services, if you will, that includes lowering costs. They also strengthen your organization to provide high quality healthcare. They also help you to maintain or meet regulations and standards for compliance. The great thing about the AAAHC is that a lot of their standards also encompass like HRSA facilities that are Section 330 grantees, as well as the Indian Health Service OUIHP site visit manual components as well. So it's a really great crosswalk so that your organizations are performing the same checks and balances across all three organizations. They also offer peer-based learning, and again, as mentioned, educational resources. The association, Accreditation Association for Ambulatory Health Care Services are eligible to urban Indian organizations under the terms and pricing of the national contract. So we're going to segue into the IHS contract that we currently have in place. Next slide, please. So the IHS does have a partnership with the AAAHC, which can be accessed through sending a request to Commander Shannon Vial, the OUIHP contracting officer. The OUIHP will review your request and approve accreditation services and access to all of their resources for UIOs based on the availability of funds in the contract, and only requests from an approved IHS funded urban Indian organization specified in their contract will be considered valid. We did place Commander Shannon Vial's information here, and one of my colleagues can go ahead and paste that into the chat box as well so that you guys also have that. Next slide, please. So when starting the AAAHC process, one of the first steps is to know the accreditation process. And the great thing about the AAAHC is that IHS has actually created a process in which they can help you to develop this knowledge and best practices and gain access to the resources. The AAAHC manual or handbook version 41 usually is at cost to folks who want to attempt accreditation, but under the IHS contract, it is available included in their contract services. You also get a copy of the patient safety toolkit. You also do have access to their archived webinars for preparation specifically for tribal and IHS facilities. You also do have an offer to complete an organization assessment and policy checklist. So that just shows OUIHP what your organization has done and completed. You also do have an option of obtaining an off-site consultation by the AAAHC for the mock survey. It also takes care of the fees for the application survey. And again, as mentioned, prepares you for the accreditation survey as well. So Commander Vial would be a great resource if your organization is looking to obtain the AAAHC certification or accreditation. Next slide, please. In the deeper dive session, as mentioned, that's going to be held on March 18th from 1 p.m. Eastern Standard Time. And our presenters for that will be Mona Sweeney, who is from the AAAHC. She will be on hand to go over some objectives, which we'll go over in just a moment for this particular session. Commander Shannon Vial will also be in attendance during that session for any questions you might have about the IHS contract. And we also do have Brian Robles from the Native Health in Phoenix, Arizona Center, and he's the manager of quality there. So they're going to be going over the AAAHC standards and any recent updates. They're also going to show us how to complete the UIO facility assessment using the AAAHC standards, and also some best practices for our UIO site visits. Next slide, please. So from the AAAHC, from Mona Sweeney directly, here are some objectives that she will be touching on more specifically in her presentation. She does list understanding the benefits of achieving and maintaining accreditation through the AAAHC, Again, learning about the IHS contract, reviewing what the AAAHC accreditation process looks like. She'll also touch on what happens before the survey as well as after the survey. And that's going to be included in that description of timeline activities for survey readiness. Next slide, please. So here's a list of some resources where you can go. Again, the AAAHC website is a great hub for getting some initial knowledge. You're able to head there and check out their education center as well. It's a really great place to go for at least startup tools. And again, Commander Shannon Vial's information is there as well as in the chat box. And so with that, I will go ahead and if you guys have any questions, if you could place that in the chat box to the right, as we will be hosting a dedicated Q&A session at the end of our presentation. And next up, we do have Ms. Tiffani Stark, and she will be providing an overview of the Joint Commission. Next slide, please.
Hi, everyone, and thank you, Zep. Welcome to today's session, and I will be going over the overview for the Joint Commission. Next slide, please. So the Joint Commission was founded in 1951. The Joint Commission seeks to continuously improve healthcare for the public in collaboration with other stakeholders by evaluating healthcare organizations and inspiring them to excel in providing safe and effective care of the highest quality and value. The Joint Commission evaluates and accredits more than 22,000 healthcare organizations and programs in the United States. Next slide, please. The Joint Commission, also TJC, is an independent and nonprofit organization, and the Joint Commission is both the oldest and largest accrediting and standards body in the United States. Oh, could we go back, please? I'm sorry. And in order to obtain and retain the Joint Commission status, an organization must have an on-site survey completed at least every 3 years by a Joint Commission survey team. Next slide, please. And next we have the accreditation programs. So first we have the hospital. So that includes general, children's, psychiatric. Next we have home care. So home health, hospice, and pharmacy. Next we have nursing care center, which includes post-acute, subacute. Next we have behavioral health care, such as mental health and addiction treatment. Ambulatory care, so ambulatory surgery centers, medical groups, urgent care centers, and laboratory services, independent or freestanding clinical laboratories. Next slide. And next we have the accreditation process. And so first we have the standards. So the Joint Commission standards assist in creating initiatives to help in identifying issues and opportunities and improving patient care. Examples of the Joint Commission standards include infection prevention as well as medical management. And next we have the survey process. So there is an all accreditation program survey activity guide, and this is broken out by program. So it helps provide information to prepare for the survey, and it's an abstract of each survey activity that includes logistical needs, session objectives, an overview of the session, and suggested participants. The sessions are listed in order that they are conducted. And I could also drop this in the chat box following this discussion as well. And next we have accreditation decisions. Accreditation is given to organizations that are in compliance with all standards at the time of the on-site survey, or they have successfully addressed all requirements for improvement. And next we have expectations of accreditation. In order to obtain and retain the Joint Commission status, an organization must have an on-site survey completed at least every 3 years by a Joint Commission survey team. And then also another big thing to note is if there's any big change, as soon as they are contemplated, to let the Joint Commission know. And this is because certain changes may require a need for an on-site survey. Next slide, please. And so for this slide, we'd like to take a look at how the accreditation process is broken out. It's broken out by learn, prepare, and sustain. So first, connect with the Joint Commission, then review the requirements, the survey readiness, complete the application, survey participation, and promote achievement. Next slide, please. And here we have a list of certifications with accreditation. And as we can see, there's a bunch of them. So just to name a few of them, we have the suite of advanced cardiac certifications, community-based palliative care certification, integrated care certification, as well as primary care medical home certification. Next slide, please. And here we have certifications without accreditation. So there is that opportunity to get a certification without being accredited. So we have Comprehensive Stroke Center, Acute Stroke Ready Hospital, Ventricular Assist Device, and Lung Volume Reduction Surgery, just to name a few. And so what are the benefits of being accredited by the Joint Commission? So it helps organize and strengthen patient safety efforts, strengthens community confidence and quality of patient care, or safety of care, excuse me, and treatment and services. It provides a competitive edge in the marketplace. It improves risk management and risk reduction, may reduce liability insurance costs, provides education to improve business operations, provides professional advice and counsel, enhancing the staff education. Next slide, please. And it also provides customized intensive review, enhances staff recruitment and development, provides the authority for Medicare certification, recognized by insurers and other third parties, provides a framework for organizational structure and management, may fulfill regulatory requirements in select states, provides practical tools to strengthen or maintain performance excellence, and aligns healthcare organizations with one of the most respected names in healthcare. Next slide, please. And so next we're going to go over the application process. So first step would be to request the application. And then after that, after the request is processed, you'll receive an email providing login information, which you can access the electronic application anytime from any computer. The login credentials will give access to your own intranet page where you can review and complete the application in stages. There is no need to complete the application in one sitting. You could save it in sections as you go. Also, the application is valid for 1 year from the date requested, giving you enough time to prepare for the on-site survey. Submit your completed application. Don't forget to indicate the month and year which you would like your on-site survey to take place, and specify any dates your organization cannot participate in a survey. And the last step would be to submit the deposit electronically. Before the Joint Commission can process the application, they must have the deposit, which is non-refundable and applied to your total accreditation cost. And then submit your deposit promptly to ensure a timely on-site survey. And here we have some resources to follow up on. So the biggest one would be the Joint Commission website, as well as going through the accreditation benefits and even certifications without accreditation as well. And with that, I would like to thank you, and I'd pass the baton over to Mr. Marc Clark.
Good afternoon. I hope you're not suffering from information overload yet. We'll continue with CARF International, the Commission on Accreditation for Rehabilitation Facilities. Next slide, please. The Commission on Accreditation of Rehab Facilities, CARF, was founded in 1966. It's an independent, nonprofit accreditor of health and human services. CARF accredits around 47,000 programs, and that's a number that's growing, and services with more than 20,000 locations on 5 continents. It should be noted that CARF is actually CARF International, and there's a sister agency of CARF in Canada. There's a CARF, a European division of CARF, so it's a really widespread organization. Just a little bit of the history of CARF. Since its founding, it's grown and expanded to cover a wide range of not only services and agencies. During its evolution, the Goodwill of America turned over its accreditation responsibilities to CARF, and it began working with employment rehab. As a result of that, also the Veterans Administration turned over its medical rehab program responsibilities to CARF. And again, that expanded its capacity to do medical rehab. As an example of this kind of evolution, In 1997, the Health and Human Services through SAMHSA offered a contract to CARF to develop and implement an accreditation process for opioid treatment programs. Since that, the evolution of that program, CARF has expanded to accredit 60% of all the opioid treatment programs in the United States. So as you can see, they've grown rapidly. In 2007, CARF began accrediting suppliers of durable medical equipment. So not only have they grown horizontally throughout healthcare, but in a variety of other areas that they've grown vertically through this effort to accredit supplies of durable medical equipment. In 2008, they added the quality framework that they refer to as ASPIRE, an acronym, and they have added quality assessments and quality improvement to all of the manuals that they use for directing the survey process. And also in 2008, they began to offer online services. So the mission of CARF is to promote the quality, value, and optimal outcomes of services through a consultative accreditation process and continuous improvement services. Next slide, please. What is CARF? Again, one of several organizations that can provide accreditation to agencies that meet their requirements for services in behavioral health, aging, youth, employment, community services, opioid treatment, and medical rehabilitation. CARF's process features what they describe as a balanced approach, and by that they mean in addition to its look at operations and clinical processes within an agency. They also work with management, and they offer this sort of advice in a way that is meant to be what's described as a strength-based inquiry. So this balanced approach offers a 360-degree approach to looking at an agency's needs. The consultative approach is embedded in what CARF offers through its surveyor teams, and again, since its founding in 1966 and the evolution of standards, CARF's processes are embedded in peer networks and standards that developed within the field, so that their standards are comprehensive, and they, again, with this consultative balanced approach, include a focus on administrative operations. Next slide, please. So what are reasons to be accredited by CARF? And these will sound a lot like some of the reasons you've heard from others. In addition to the quality improvement philosophy that's embedded in what CARF offers, licensure often states or even billing for medical assistance may hinge on services being accredited. The CARF guidelines help to improve the quality of care, and so better services are a result of the overall CARF process. CARF accreditation or accreditation in general may be a requirement to meet grant or Indian Health Service requirements. So the specific IHS requirements are there as guidance, but some have noted that the CARF guidelines tend to be stricter than guidelines from some of the public health agencies like IHS. And then finally, the CARF accreditation process offers the potential to look at risk assessment from a managerial standpoint. It can assist with organizational accountability, as well as helping to identify risks that may endanger the safety or health of clients within programs of the organization. So there are a lot of advantages to accreditation. Next slide, please. The 10-step accreditation process, and I promise you not to go through each and every one of them. I think the key feature is the description of their survey as consultative, getting ready for the survey, the self-evaluation begins the process. So in effect, the survey, being prepared for the survey, the aftermath of the survey is all part of a continuous process. Once the survey is completed, and I would direct your attention to steps 7 and 8, there's an accreditation decision that's rendered based on the survey and the report, and the requirement then is that a quality improvement plan, a QIP, is submitted to CARF as part of that process. So the QIP actually sets the stage for future reaccreditation and becomes part of a continuous program improvement. So within the accreditation process itself, this continuous CQI philosophy is embedded through the CARF accreditation process. Next slide, please. So some of the outcomes from the accreditation, again, the formal review that you get as a report, that was the step number 8. The other outgrowth of the process itself is what could be described as informal feedback that's available to you through the surveyors. The team of surveyors will be there and on site with you, and you'll have an opportunity to have some one-on-one time as the survey is underway, and likely that would include informal feedback about observations made by the surveyors. You'll be expected, of course, to make changes based on the recommendations of CARF. The length of accreditation periods available through the CARF process are 6 months, 1 year, and 3 years. Next slide, please. It's been noted, and this is from a rather recent conversation with some of our UIOs, that there's a process that's been used due to COVID-19 that can involve what's described as a digital site survey. Part of that process involves sharing files, and of course, patient information must be kept confidential in that sharing process. The software that's embedded, Microsoft Teams, helps with the survey. The other items that would be shared during this digital process could include policies and other specific documents that you would be directed to upload to prepare for the survey. So the way in which this digital process then could unfold, in some respects, as we're all getting adapted to not only distance learning, Zoom webinars being a prime example, this digital approach to the visits has the potential of maybe establishing a new normal for how site visits and surveys may take place. So I would encourage you to, if you're interested in the CARF process, I'd strongly encourage you to take a look at their website and their homepage. There's a lot of helpful resources there that can tell you about some of the changes and the protocols for the CARF accreditation process. Next slide, please. Again, resources I would direct your attention to, and if you'd like to drop them in the chat. What a survey really wants to tell you is kind of a informal observation from persons who actually conduct a survey that describes what people would look for when the CARF survey site is in operation. Also, preparing for your first survey is a document available through the CARF International website. So I'd encourage you to take a look at those resources. Next slide, please. As with our other accreditations, there will be a deeper dive into the CARF process featured by a representative of CARF who will join us, Michael Johnson, as well as Dustin Richardson from our UIO Lifelines in Baltimore. The date for that deeper dive is April 8th. Again, the time from 1 p.m. to 2:30 p.m. We will look forward to a little lengthier conversation. So all of your questions and detailed concerns, comments, and observations will get a full treatment. The objectives of that deeper dive session with CARF is to look at an overview of the CARF standards and recent updates to their process, instruction on how to complete a facility assessment using the CARF standards, and also an assessment of best practices for site visits with a special emphasis, again, on changes during the COVID-19 pandemic. So thank you for your attention. I'm going to pass the baton back to Zep Fuller.
Yes, thank you so much, Mark, for that. So we're going to go ahead and dive into the next accreditory agency recognition, I should say, for NCQA, the National Council of Quality Assurance, measuring quality and improving healthcare. Next slide, please. So the NCQA mission is to improve the quality of healthcare, and they envision better healthcare, better choices, and better health. Next slide, please. So about the NCQA, they point the way to healthcare that says science works. They also have studies about how well healthcare plans and doctors provide scientifically recommended care. They also identify organizations that are run in ways that make care better. The way in which NCQA works is that it saves thousands of lives, helps millions of people stay healthy, and saves the country billions of dollars. And so the next slide will actually go over, in the next slide after this, we'll go over into a deeper dive as to what their system or model of quality looks like. Next slide, please. So the way in which NCQA works and what they do is they use measurement, transparency, and accountability to highlight top performers and drive improvement. In the early 1990s, they measured and then accredited health plans. And so the measures that you'll notice is they are the founders of the HEDIS metrics. And so we'll go over that in a minute just as well. Since 2008, NCQA grew to measure the quality of medical providers and practices as well. And they also have government and private sector clients that hire them through contracts and grants to help them measure and improve quality within their organizations. NCQA also maintains a reputation for high ethical standards and commitment to such ethical behavior. Next slide, please. And I know this slide looks a little busy, but it's definitely a good slide to keep in mind because the NCQA is focused on the patient-centered medical home recognition. In order to be recognized, these are their pillars of a foundation, if you will, in which they strive to drive good patient outcomes based on the quality care that our organizations do provide. So first and foremost, their standards and guidelines measure performance, so it makes sense that they believe in standardization, trying to improve by doing certain things the right way, at the right time, every time. They also hold on to the mantra to measure, analyze, improve, and repeat. And as mentioned there, it is the heart of their work. Public reporting of performance against their measures and standards becomes the focus for groups. And the great thing about them is they release results publicly so that everybody can see what sort of quality skill sets, quality services that organizations are providing, and that sets higher goals and the ability to continue improving. They also take a look at the triple aim of lowering costs, having and providing better healthcare, and also a better patient experience. The link there, it will be clickable in the PDF, but the evidence shows that delivering coordinated care at the right time can cost less and lead to healthier and more satisfied patients. They also rely on an effortless experience in terms of being a workplace. So they have a little mantra or quote there, improving healthcare is hard, working with NCQA should be easy. Like the AAAHC, they also are a learning organization and also will help your organization to use toolkits, strategies, courses in order to help you improve the services of care to your community. Next slide, please. Some of their programs, as mentioned, include HEDIS. As mentioned there, more than 191 million people, over half of our country's population, are enrolled in health plans. And so they're the organization that helps health plans achieve better patient outcomes and to really take a look at population health and how organizations are delivering that care. They also include the health plan accreditation for those folks that are meeting those HEDIS standards. The area that we're going to focus on for our deeper dive session is going to be that patient-centered medical home recognition. Their standard there is that a medical home is not a place, but a way to organize primary care. So it's the way patients want it to be. Since 2008, they built the most widely used medical home model. More than 13,000 practice sites and 67,000 clinicians have earned the NCQA PCMH recognition seal. Next slide, please. This next slide is very, very important as it does tailor as to why NCQA PCMH. Why do we want to have our organizations, why do we want them to achieve this recognition? And it's because the patient-centered medical home is a model of care that puts patients at the forefront of care. So some byproducts when you achieve the recognition is you reduce fragmentation, you're able to align with payers, you can improve staff satisfaction, also improve the patient experience. You're also able to manage better manage chronic conditions. You can also align with state and federal initiatives. I would also like to echo that with the PCMH, when you go through the accreditation series, it also touches on some of the same elements as the AAAHC patient-centered medical home standards as well. So in essence, again, that crosswalk over different regulatory agencies is also still apparent. It also helps to lower healthcare costs and also improve patient-centered access. Next slide, please. So with the NCQA recognition process, and again, we didn't want to go too deep into what that looks like in timelines, because we will have a deeper dive session coming up. Just getting started with the PCMH recognition, again, step 1 would be to know the recognition process. Step 2 would be to obtain the standards and guidelines. Step 3 would also be to check out the pricing and payment options. They do have NCQA certified PCMH recognition certified staff that can come on site to help your organizations as well. So you can also contract their services as they've mentioned. You can also get education and training. And you can also sustain recognition through an annual report that the NCQA PCMH recognition process does require. They also have one distinction program currently, and that includes the behavioral health integration. So they recognize primary care centers that put resources, protocols, tools, and quality measures in place to support the broader needs of patients with behavioral health related conditions. Next slide, please. And we do have a quick 2-minute video to show you, which provides a good introduction over the NCQA PCMH transformation. And if you could roll that, oh, thank you.
Recognition. There are 3 parts to our recognition process. We work with you through each of them. Part 1 is commit. Enroll in the recognition program in QPAS, our online portal. We'll want all of your relevant information. For example, how many practice sites you have, how many clinicians you have, what are their specialties, and so on. You also pay your fees at this time. Part 2 is transform. This is where you get down to work. You begin to transform your practice. NCQA assigns a representative to guide you throughout the entire process. You fill out a questionnaire that gives your representative more specific information about your practice and its operations. Then, the representative schedules an initial introductory call with you to introduce themselves and discuss the process. The details from the questionnaire prepares your representative to guide you as you outline a transformation plan. Your representative shares recommended pathways, makes sure you know where to find program resources, including requirements, education, and available training. Your representative also works with you to set an evaluation schedule. If you use a patient-centered medical home certified content expert, include them in this initial call and throughout the process. Together, you develop a virtual review schedule. During transformation, we hold 3 virtual reviews with your team. Prior to these virtual reviews, your team gathers evidence and prepares documentation. But paperwork won't tell the whole transformation tale. We want to hear your transformation story. So at each virtual review, you and your team share your computer screens with an NCQA evaluator and discuss your progress. During the first review, we look at what your practice has done to build patient-centered care. It's okay if things are missing at first. We look at them again in later virtual reviews. A reminder, remember to identify and invite appropriate members of your team for your virtual review. And again, don't forget your CCE if you've hired one or if you have one on staff. Part 3 is succeed. After you earn recognition, you update us every year. You send a sample of data and documents that complete the annual reporting requirements. That way, we know your practice continues to function as a patient-centered practice. It's proof you are committed to high-quality patient care. Again, congratulations and our very best wishes for a rewarding transformation journey ahead.
Thank you so much for playing that, Noelle. And I know we do have just one more slide to go through, which is actually going to go over our deeper dive session. So the National Committee for Quality Assurance deeper dive session will be held on April 22nd at 1:00 p.m. Eastern Standard Time. And so the host for that will actually be Christina Borden, who is from the NCQA, and also Dr. Anupama Balrakshan from Indian Health Center of Santa Clara Valley. And the objectives for that are also to review the NCQA standards and recent updates, and also completing a UIO facility assessment and readiness to see if NCQA PCMH recognition is for you. You'll also hear about some best practices from the Indian Health Center of Santa Clara Valley, again, with a special emphasis on changes during COVID-19 about some of their best practices as well. So we're hoping that you could join us for that session. Thank you all so much for your time as well. And I'm going to go ahead and turn the baton over to Miss Emily.
Thank you, Zep. Thank you to Mark and Tiffany as well for your wonderful presentations and for giving us a very comprehensive overview and foundational knowledge so that we can hopefully go forward into this accrediting process and our next sessions. As we proceed with the opportunity to ask any questions of our presenters that you may have. Before we proceed to that, we do have a couple of polling questions that will appear on your screen. You'll have about 30 seconds to answer them. No pressure, it's not a test. We do not anonymize the data, but any results we share are anonymous. So I will be sharing those after we complete them. And hopefully those will be up shortly. In the meantime, if you do have any questions, do feel free to put them in the chat box. Thank you to everybody who's voted. I'll just give you a couple more seconds. I know it took a minute to pull that up. And I will share the results. So the question was, AAAHC awards accreditation to qualifying ambulatory healthcare clinics organizations for a 5-year term. A majority said false. Zep, did you want to touch on that?
Yeah, so they actually award accredited ambulatory health centers a 3-year accreditation term. So yay for everybody who said false. Great job.
Thank you. And next up, we have a question on the Joint Commission. If you wouldn't mind answering the true-false question for this as well. And we'll have a couple more just on CARF and NCQA, so no surprises. Thank you to everybody who voted. Again, we have a majority saying true in this instance. Tiffany, did you want to speak to the answer of this?
Yeah, the answer is true. There are some that are not required for accreditation.
Thank you. And of course, I wanted to add that any information, if you require it for review after the session, is going to be available to you in a follow-up email. So moving on, you should be able to review that information if you feel that that's necessary. And next up, we have a poll for CARF. So we'll have a couple seconds to respond to that. Excellent. Thank you, everybody, for responding. We do have 90% of respondents said false. Mark, would you like to comment on that answer?
Sure. Thank you. The CARF, C-A-R-F acronym stands for Commission on Accreditation of Rehabilitation Facilities. So although reimbursement is a concern in healthcare, that's not what CARF works with. Again, that's rehabilitation facilities. Thank you.
Thank you, Mark. And finally, we do have our NCQA knowledge check question coming up. So we have a 100% response rate for true. Zep, can you confirm or deny this?
Yes, I can confirm. Great job, everybody.
Awesome. Thanks everybody for participating. We really appreciate it. And we hope we can see actually that you have enjoyed the session as well, and that it was hopefully helpful for you and your work. As we move forward, we did want to give you space to ask any questions of our presenters. You can unmute yourself or you can enter your question in the chat box, whichever you feel most comfortable with.
I'd also like to just quickly chime in too that as you go and visit these accrediting body websites, if you have questions as you talk through any information you might have received today and prepare it for the next sessions, that would be great too. Just bring in with you a list of questions ready for our presenters for the deeper dive sessions. So that would also help out too, if there's no questions currently.
Thank you, Zep. That's a great point. Oh, I do see one question from Bertha in the chat box. Bertha did want to ask if AAAHC has a PCMH section as well.
Yes, they do. Included in their standards, their version 41 manual, they also encompass PCMH standards of care and guidelines as well. And you can be AAAHC accredited as well as achieve NCQA PCMH recognition. Again, the difference is that the NCQA PCMH is solely certified as a recognition agency. And so again, being that they deal with health plans, the HEDIS measures as well, theirs is more comprehensive and more robust than the AAAHC PCMH. Does that answer your question, Bertha? Did you have any follow-up questions? Yeah, absolutely. You're welcome. Great question.
Thank you, Zep. We'll just give everybody a couple more minutes or a couple more minutes on any questions. And if you want to note them down for any deeper dive sections, as Zep noted, that would be awesome. I know sometimes for me, I like to, think these things over before I go outright and ask an inquiry. Okay, I think we're going to move forward towards wrapping up this presentation. As always, of course, you can feel free to email any of us, especially after you will receive your follow-up email with our information. So feel free to email anybody if you do have questions that come up after this. But in the meantime, we do want to invite you to fill out our post-event survey. We always welcome your ideas and feedback. I mean, our work here is really to help you. So anything you want to provide that we can help improve for you, even if it's just a technical request, anything like that, please do feel free to share with us. And that survey is in the chat box as well. Moving forward to the next slide. We wanted to alert you to the upcoming events that NCUIH is hosting this spring. You, of course, have heard about the deeper dives for the rest of the accreditation series, and all of those registration links are in the chat box, and they'll also be in these slides when you receive them. So the next session, as mentioned, was for the AAAHC. But in the meantime, we also have a separate event going on, a separate series focused on promoting mental wellness among Native youth. So that session is on March 16th from 1 to 2 p.m. EST, and it is focused on providing clinical telebehavioral health services to Native youth during the COVID-19 pandemic. So if you want to register for that, the registration is also in these slides, so you will be able to access that. And that is the only upcoming events that we have at the moment. Stay tuned. I'm sure we'll have other things that we're working on in the future. But next slide. We just wanted to say thank you for your time today, taking the time to spend your afternoon with us and learn about these important organizations and their functions. Any kind of resources you require, please don't hesitate to reach out. Thank you to our wonderful in-house NCUIH presenters for taking the time to share their expertise with us as well. And I wanted to wish you all a great afternoon. And I appreciate your time. I hope to see you at the next upcoming sessions. Thank you.
Thanks, everybody.
Thank you.
Bye, everyone.